Hello, students and brainiacs. This is Dr. CeCe, chiropractic doctor and neuro nerd. Today, we're diving into one of the most popular spinal plexuses in your body, the sacral plexus. If you've ever wondered where that sciatic nerve comes from, this is its secret headquarters. Today, we're breaking it down in a super simple way so that you'll understand what it is, what it does, and why it matters. By the end of this video, you will be a pro. Let's get started. You have two groups of nerves in your body. One group belongs to the central nervous system, and the other group belongs to the peripheral nervous system. The peripheral nervous system includes your spinal nerves, which branch out from the spinal cord at different levels in your neck, mid, and lower back. And they travel all the way down your arms and legs into your fingers and toes. These spinal nerves innervate your body's skin and muscles and help you to move and feel your limbs. Now, we've already covered the nerves of the central nervous system in our Cranial Nerves Made Super Simple video. In this series, we're going to focus on the major spinal plexuses of the peripheral nervous system. Spinal plexuses are networks of intersecting nerves formed by the merging of the anterior rami of spinal nerves. They are web-like structures that sort and recombine nerve fibers to send them to specific parts of the body, creating larger nerves that serve specific regions like the head, the neck, arms, or legs. Think of it as the Wi-Fi router of the spine that branches out and sends signals to the skin and muscles throughout your body. You have 5 major spinal plexuses: cervical, brachial, lumbar, sacral, and coccygeal. This quick lesson will focus on the sacral plexus. Think of the sacral plexus as a nerve party happening deep in your pelvis, located right in front of the sacrum, that triangular bone right above your tailbone. These are a powerful network of nerves formed by the ventral rami of L4, L5, S1, S2, S3, and part of S4. And they sit on the anterior surface of the piriformis muscle located inside your pelvis. This plexus gives rise to nerves that control your glutes, legs, pelvic floor, and even the skin of your butt and thighs. We're going to go through them one by one and tie in the name, origin, and function of each nerve, along with some fun mnemonics. Let's center this lecture at the gym to help us understand in a super simple way how the nerves of your sacral plexus operate and how they function in your workout routine. It's leg day at the local gym, and all of the sacral plexus nerves are here. Let's drop in. First up, let's meet our VIP, the big dog and celebrity of the sacral plexus, the sciatic nerve. This nerve has quite the reputation for hurting people, but it often gets a bad rep. As you'll soon see, it's only responsible for about 75% of the pain that it's accused of, but we'll get into that. The infamous sciatic nerve originates from the L4, L5, S1, S2, and S3 spinal roots, and it runs all the way down your butt and leg into your foot. It is the longest and thickest nerve in your body. Yes, it's called the big dog for a reason, and it knows it. In the leg, it divides into two branches, the tibial and the common fibular nerves. I guess you can call them the sciatic nerve's minions. We'll meet them later. The sciatic nerve motors the hamstrings, except the short head of the biceps femoris. And it also motors part of the adductor magnus and all the leg and foot muscles via its branches. It's also sensory to the skin of the leg and foot through the tibial and fibular branches. This nerve enables you to walk and feel your feet. Sciatic nerve exercises focus on gentle stretching and core strengthening to relieve pressure with key moves like knee to chest, figure 4, piriformis stretches, pelvic tilts, and core stabilizers like bird dog and dead bug. These exercises help reduce pain, improve mobility, and support the spine. But always stop if pain worsens. Clinically, you'll need to watch out for sciatica. This is a big one that chiropractors see every single day. Sciatica can range from a temporary nuisance to a very serious condition, usually resolving with home care in about 2 to 6 weeks, but severe cases can cause chronic pain, weakness, or permanent nerve issues. It becomes very serious if you have sudden loss of bladder and bowel control, severe leg weakness, or unbearable pain requiring immediate medical attention. Most cases, though, improve, but severe nerve compression needs prompt treatment to prevent long-term damage. Next, we have our twins, the superior and inferior gluteal nerves. They make up the glute boss squad. Together, these twins fire up your glute medius, maximus, and minimus muscles. They do this by dividing the labor. The superior gluteal nerve, the first of the twins to originate. It comes from the L4, L5, and S1 spinal roots. This nerve motors the gluteus medius and minimus, and the TFL, the tensor fascia lata. Not a fancy drink, but a small hip muscle that helps control hip and knee movement and helps the glute medius and minimus stabilize the pelvis. The superior gluteal nerve's function is pelvic stability and hip abduction, moving the leg out and away from the body's midline. Exercises for the superior gluteal nerve focus on strengthening hip abductors and stretching tight glutes and hips. Great exercises are side-lying hip lifts, clamshells, hip hikes, and single leg squats. Clinically, look out for Trendelenburg gait, a distinct wobbly walk where the pelvis drops on the unsupported side when one leg is lifted, caused by weakness in the hip abductor muscles, especially the gluteus medius, which fail to keep the hips, pelvis, level. The inferior gluteal nerve. It may be named inferior, but that's only because it originates a little lower on the plexus, from roots L5, S1, and S2. And it's got one big job. It motors the gluteus maximus. Its function is hip extension and explosive power. Think plyometrics, box jumping, jump squats, stairs, running, and lifting. Clinically, you'll see weakness in lateral rotation and an inability to powerfully extend the hip, making it difficult to get up from a chair or to climb stairs. The pudendal nerve. This is the private business nerve. It controls pelvic floor muscles. It originates from roots S2 through S4. Here's a fun mnemonic to help you remember. S2, S3, and S4 keep the poop off the floor. This nerve provides motor to external genitalia and the perineum, the diamond-shaped area of skin and muscle between the anus and the genitals, vulva in females and scrotum in males. The perineum is crucial for pelvic support, urination, defecation, and sexual function. Pudendal nerve exercises focus on relaxing and stretching pelvic floor muscles, not strengthening like Kegels, but using gentle yoga and stretches like kneaded chest, butterfly frog, shin box, and pigeon. And, of course, breathing to relieve tension and pressure on the nerve, while avoiding activities that aggravate it, like prolonged sitting or deep squats, with proper form and deep breathing crucial to calm this nerve. Clinically, this nerve can be compressed in cyclists or those who sit for very long periods of time. Think Uber driver or student. It's a condition called pudendal neuralgia, and it shows up as burning, sharp, or shocking pain in the genitals, anus, and perineum, or pelvic area, often aggravated again by sitting. Plus, you may also see bladder, bowel, and sexual dysfunction with this one. The posterior femoral cutaneous nerve. This nerve originates from roots S1, S2, and S3. It is pure sensory, absolutely no motor function. Sensory only for the skin of your lower buttocks, back of the thigh, and the upper calf. Exercises for the posterior femoral cutaneous nerve, we'll just call it PFCN. Focus on nerve gliding, stretching tight muscles, the glutes, the hamstrings, the hip flexors, and improving pelvic stability to relieve pressure and improve nerve movement, like femoral nerve glides, head-hip coordination, kneeling hip flexor stretches, glute bridges, and side-lying leg raises, all done gently, very gently, to avoid irritation. Clinically, it can cause deep pain and burning in the buttocks, peroneal and posterior thigh if irritated. Now, this one is often mistaken for sciatica due to compression. Again, sitting, it can come from trauma, it can come from surgery or injury, and it presents as burning, numbing, or tingling, though typically without any motor weakness. Nerve to the piriformis. Now, this is a good one. Every piriformis needs a friend because it is a real pain in the butt. Originating from roots S1 and S2, this nerve motors the piriformis muscle, and its function is hip external rotation. The focus is on stretches, like the figure 4 stretch, either lying down or seated, and strengthening with exercises like clamshells, fire hydrants, and bridges, all designed to release tight muscles and improve hip mobility. Clinically, you'll see this a lot, but it's often confused with sciatica, or rather classic sciatica. It's called piriformis syndrome. Here, the piriformis muscle, when tight or in spasm, compresses and irritates the nearby sciatic nerve, causing pain, tingling, or numbing in the butt and down the leg, kind of like sciatica or classic sciatica. The top causes are a trauma, like a bad fall, repetitive activity like cycling. Now, bicyclists really can suffer from piriformis syndrome. So anyway, cycling, heavy bike riding, prolonged sitting, or anatomical variations where the sciatic nerve splits and runs actually through the piriformis muscle. The tibial nerve. This is a key branch of the sciatic nerve, originating from the same sciatic spinal roots of L4, L5, S1, S2, and S3. It motors the hamstrings, posterior leg muscles, and plantar foot muscles, the bottom of the foot. And it's sensory to the skin on the sole, bottom of the foot. Clinically, you'll see tarsal tunnel syndrome with this one, which is compression of the nerve in the ankle's tarsal tunnel. It causes foot pain, numbness, and a lot of tingling. You may also see tibial compartment syndrome, which is an increased pressure in the lower leg, causing aching and tightness. Also, it can show up as diabetic neuropathy, or it can be deeply affected by diabetes. Diabetic neuropathy can dramatically affect this nerve, causing nerve damage and leading to burning, tingling, and impaired sensation in the feet. Exercises to help this nerve will focus on nerve glides to help improve movement and reduce pain by gently moving the nerve through its path, focusing on ankle and foot motions, often done lying down or sitting to gently stretch and release the nerve along the back of the leg and into the foot. The common peroneal nerve, or common fibular nerve, depending on what you'd like to call it. It has two names. It originates from the spinal roots of L4, L5, S1, S2, and it is a crucial nerve in the lower leg, branching from the sciatic nerve near the knee and responsible for sensation on the outer leg and top of the foot. And it controls the muscles that lift the foot, called dorsiflexion, and turn it outwards, eversion. It motors the short head of the biceps femoris and anterior and lateral leg muscles. It's sensory to the dorsum, the top of the foot. Clinically, you'll see it as drop foot when injured at the fibular head. It causes symptoms like numbness, tingling, weakness, and foot drop, where the foot drags when walking. Much like the tibial nerve, The focus is on flossing or gliding the nerve to improve mobility using gentle, repetitive movements like ankle dorsiflexion, toes up, and plantar flexion, toes down, combined with foot inversion, toes inward, and eversion, toes outward, often incorporating head-knee movements for tension while strengthening exercises like heel raises and ankle inversion with resistance bands build muscle support, all aimed at reducing pain and improving function. Nerve to quadratus femoris and inferior gemellus, originating from spinal roots L4, L5, and S1. This nerve motors both the quadratus femoris and the inferior gemellus muscles. It helps with lateral hip rotation and adduction and hip stability. Exercises focus on strengthening the quadratus femoris, the QF, and the inferior gemellus. The focus is on deep hip external rotation and stabilizing exercises like three-point hip rotations, clamshells, which I absolutely love, side-lying hip lifts, hip leg lifts, and controlled side-to-side squats. Clinically, compression of this nerve or the surrounding structures can lead to deep gluteal syndrome, known as DGS, and it causes butt and thigh pain and can sometimes mimic sciatica. Nerve to the obturator internus and superior gemellus. This nerve originates from spinal roots L5, S1, and S2, and it motors the obturator internus, which is a deep hip joint muscle, and the superior gemellus muscle, which is part of the deep lateral rotator group of the hip. It provides some sensory innervation to the hip joint. Its function is external rotation and stabilization of that hip joint, also assisting in hip abduction when the hip is flexed. Think about getting out of a car. This nerve is crucial for those movements. Exercises focus on strengthening hip external rotation and improving pelvic floor health using moves like, again, my favorites, clamshells, side-lying hip abduction, piriformis stretches, and nerve glides, often with resistance bands or gentle stretching to improve the function, reduce pain, and support the pelvic floor. So, why does it matter? And what do all of these nerves actually do? When you walk, run, squat, pee, poop, or stand on one leg, congratulations, you're using your sacral plexus. It powers your glutes, stabilizes your pelvis, controls your leg muscles, and gives sensation to your butt, thighs, and feet. Leg day at the gym would not be the same without them. Pop quiz. Can you answer the following two questions? First, which nerve is the longest and thickest nerve in the sacral plexus? Number two, which nerve has the roots S2, S3, and S4? Bonus if you can answer what it keeps off the floor. Drop your answers in the comments. I'll post the correct ones there. You just learned all 10 nerves of the sacral plexus super fast. You now know their names, origin, and functions, along with exercises for each and how they show up in a clinical setting. Thanks for hanging out with me. If you want more fun breakdowns of complicated stuff your body does, hit the like button and subscribe to the channel, and share this with a friend who keeps blaming everything on their sciatic nerve. There's more great stuff for you located in the playlists. This is Dr. CeCe. See you next video.